We are back with Dr. Catherine Sevier and Josh Peck, and we are talking about ACA enrollment. The deadline is today. You have just a few hours. We're also talking about Medicare enrollment as well and taking your questions. All right, this first text question up right now is ACA. It says, can you enroll in ACA coverage as an alternative to your health insurance plan that your work provides? I feel like the cost for the coverage through my job is just too expensive.
Yeah, so not usually is the answer. In extraordinary cases where your employer is essentially offering coverage that's too expensive, I think it's typically over 10% of your household income, then you could potentially apply, be eligible for marketplace coverage. But for the vast majority of people, if your employer offers coverage, that you will not be eligible for coverage through the marketplace.
Okay. This question says, I am 64, will be 65 in September. Do I have to wait until September to enroll in Medicare?
You'd have to wait, but not until September. You are eligible to apply for Medicare 3 months before your 65th birthday and must finish it by 3 months after, or face a situation where you could be paying some penalties for not enrolling.
All right, and so everybody has 7 months to apply for Medicare. They have the 3 months before their 65th birthday, the month of their birthday, and 3 months afterwards. And if you don't enroll during that time, what happens?
What happens is you will be automatically enrolled if you're on Social Security, but then from that point on, you have to pay a penalty, and the penalty goes up, particularly for Part B, at a rate of 10% a year, and it lasts your lifetime. So it's not just a one-time penalty. It goes on for the entire rest of your life as you're drawing from Social Security.
So let me clarify. Do you have to enroll in Part A and Part B?
Yes.
At that time. Okay. Don't just enroll in Part A, because if you don't, that's part of it. Okay.
There are two different parts of Medicare. Part A is hospital care. Part B is outpatient and physician care.
Okay. All right. Joshua, this person's asking, do prices for ACA enrollment change depending on your age?
They do. There are three things that matter for how much you pay when you're getting covered. The zip code you live in, your age, and your household income are the three factors that go into it.
Okay. This is kind of a long one. This person bought ACA coverage the last few years, Blue Cross Blue Shield. This year for 2021, I went through the ACA but changed companies, and I tried to cancel my policy with Blue Cross Blue Shield, but was told I need to go to the ACA website in order to cancel it. And I didn't see an option for that. Can you help with that?
Well, there is an option on the website, but the easiest thing to do may be to call the call center at 1-800-318-2596, and you can terminate there. You should be also able to do that through your carrier, so you could give them a call back too. I'd recommend doing that tomorrow since today will be very busy.
So let me ask, can you actually sign up for two different policies, or will one automatically get kicked out?
So if you're on the healthcare.gov website, you should only be able to sign up for one policy on your account. So that assumes that everything is in one place for that person's circumstances.
So then you would assume that if you looked and you saw your new coverage, that would be it, since your old coverage isn't showing up. You would assume that, but
I would assume that, though I would certainly give them a call just to make sure that things are as you think they are.
Mm-hmm. All right, this person says, I'm 60 years old and still working. Is it ACA or Medicare that helps me?
It's ACA that helps you.
That's right. And I'd go and sign up today. You have to sign up before that deadline tonight at 3 a.m. And then when you're eligible for Medicare, then you can transition into Medicare.
Okay. All right. This person's asking, I don't have insurance. I'm 64 and retired. Can I afford ACA insurance?
So the best thing you can do is find out how much financial help you're eligible for, excuse me, because, the amount of money that you're bringing in will have a big impact on how much you pay. We know that in North Carolina last year there were 325,000 uninsured North Carolinians who were eligible for a $0 monthly premium. That's 40% of the uninsured last year. And 4 out of 5 this year are eligible for a plan with a monthly premium of $10 or less. So there are very, very affordable options available in the marketplace, but it will depend on your individual situation to determine if you're eligible for those plans.
Gotcha. That takes a little bit of doing. So you need to get on there before the deadline passes. All right, we're going to come back with more of your questions.